Your fertility is much more than your ability to get pregnant. It puts you in the driver's seat and allows you to be in control. And ultimately, I want you to be the one not relying on luck, but making the right decision for your future. I was vastly underprepared for what I experienced, and I know so many women experience the same. The current system is set up that you have to fail first. Fertility is finite, and at some point, your body will make a decision for you. And I don't want that to be you. You can't make decisions on data you don't know. It's not too late, and you are the one who can make a difference. So what should you do? Welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we're talking about a topic that I think you need to understand. Your fertility is much more than your ability to get pregnant. It's not just about babies, it's a reflection of your overall health because your hormones are essential to your day-to-day life. Your menstrual cycle, your hormones, your ovarian reserve, these are actually vital signs that tell us how your body is functioning today and can give insight into your future health. So in this episode, we're covering what fertility actually means beyond getting pregnant, how your fertility changes with age and lifestyle, and what steps you should take now if you want to be pregnant or preserve your reproductive health, your hormonal health in the future. So whether you're focused on your career, unsure if you want kids, or simply curious to learn more about your body, this episode will help you understand why your fertility is something worth paying attention to right now. Well, friends, I'm so excited to have you here today, and this episode is everything I wish I had known at a younger age. Because if I'm going to be honest with you, I always wanted to be two things when I was younger. I wanted to be a mom, and I wanted to be a doctor. And when I think about this, the doctor goal, I spent a lot of time working to achieve, and I knew what to do. I knew what classes to take. I knew what entrance exams, how to take the MCAT. I knew I needed to go intern. And I had a game plan working towards that big life goal. But the I want to be a mom one day goal, you know what I did? I took birth control pills and didn't even think about it until it was time to get pregnant. When I stopped my pill and did a complete 180, thinking, now it's time to get pregnant, hoping and thinking it would just happen and nature would take its course. But the reality is I was vastly underprepared for what I experienced, and I know so many women experience the same. So why do we not approach fertility the same way that we approach our other goals? Why do we not think about and prioritize our hormonal health when we're younger, especially when we start thinking about the fact that our eggs are inside our body our entire lives, absorbing the wear and tear of all those choices we make? This is an opportunity for us to learn at a much younger age. And when it comes to knowing when things are right or wrong, I'll be really honest. This is one thing I hate about being a fertility doctor. Infertility is defined as trying to get pregnant for 12 months and not having success. And that is the point of which we will do a fertility evaluation, meaning the current system is set up that you have to fail first before you come in, and we'll even find out if something is going on. If I could do anything, in addition to helping you learn about your body earlier, helping you know what's normal so you know what's abnormal and how to advocate, I also want you to know how all the little choices are impacting your fertility now and in the future. But I also wish as an industry, we could be more proactive when it comes to your fertility. Start these conversations younger, encourage and advocate for fertility testing younger, because if being a mom one day is a goal, why are we waiting till the last minute? And even if you don't want to be a parent one day, or you're not sure if motherhood is the answer for you, your hormonal health impacts your day-to-day function, and you're going to have to learn about it at some point. Maybe you're in the throes of perimenopause. You're going to have to learn about it then when your hormones are changing. But why wait until later or wait until a problem is worse, where this is the opportunity now to make the biggest difference? So this is all the information that I wish I would have learned earlier. And to be honest, this is why the Fertility Formula, my new book, exists. And I wish I could hand it to every 20-year-old I see. But no matter what age you are, if you're listening to this, it's the right time to start really learning about your body. Recently, I went and I gave a talk, and I was talking to a young group of medical students, and they wanted to know about my life as an REI. What do I do as a fertility doctor, my day-to-day? And you know what? Everything I'm covering in this episode, I threw into that talk, because here is a group of young women who are ambitious and want to learn about their goals and achieve them. And I started talking about their fertility, cycle tracking, and the things that they should be doing right now if they want to think about having healthy hormones later. And that's what I'm sharing with you today. So let's walk back and think about a few basic facts about your body that you may not know, things I want you to know about if they're going wrong, and truly what you should start doing now if you potentially want to have kids in the future that people are not telling you. The first idea here is that your eggs are in your body your entire life. And this is a really important concept because you have the highest number of eggs when you're a baby inside your mother's womb. So at 5 months gestation, you have about 6 to 7 million eggs. When you're born, you have 1 to 2 million. And then by the time you even start puberty, you're going to have about 500,000. Most people think about puberty as the time when your ovaries start working and making hormones. But the reality is your ovaries were working well before then. Puberty is actually your brain turning on and starting to send hormones to the ovaries, getting eggs to grow. The way I like to think about this is imagining there's a vault inside your ovary, and every month there's a group of eggs that comes out. From that group, one will be chosen to ovulate and the rest will die. And the next month, another group will come out of that vault. So puberty is the brain turning on and starting to send out the hormones FSH and LH, which are hormones that cause a follicle to grow, the egg to mature, and you to ovulate. They control our menstrual cycle. So when we are going through all of those years before we've ever started a period, you're actually losing eggs every single month. And you lose more eggs when the vault is more full, and you start to lose fewer eggs as the vault gets emptier. Everybody will go into ovarian failure or menopause, which is the time period when you are all the way out of eggs. And I see too many women who are young who come to see me and find out that they have much lower ovarian reserve or egg counts than they should. And this is for a variety of reasons, but largely it's due to the life that we lead right now. Chronic inflammation, toxins in the environment. It's actually hurting our fertility, our egg number, and our egg quality. And so you can't make decisions on data you don't know. And I want you to start knowing this information earlier. So in addition to how your cycle works, I want you to think about from the get-go, what is ovarian reserve or your egg count? This is a test that can tell us how many eggs are outside the vault right now. So if you've ever had a friend who's going to get an egg count, this is what this is. Tests of ovarian reserve are with that idea that the more eggs inside the vault, more come out every month. That's what we're looking for when we test your ovarian reserve. And this can be your AMH, anti-Mullerian hormone, or an ultrasound determination called the AFC or an antral follicle count. So every month, those group of eggs that are outside the vault, you can actually see the follicles on ultrasound. So each egg grows inside a follicle. More eggs in the vault, more come out, higher follicle count. Fewer eggs in the vault, fewer come out, lower follicle count. Similarly, AMH is a blood hormone that's made from the cells that surround all of the follicles outside the vault. So if you have more inside, more come out, higher AMH. Fewer inside, fewer come out, lower AMH. These are not perfect tests by any meaning they do fluctuate a little month to month. There are certain things that can impact AMH. So if you've not ovulated in a long time because you're on hormonal contraception, you've been pregnant or in postpartum, these things will impact. They'll suppress your AMH. It's not that you'll run out of eggs earlier, but they'll be slightly lower than they should be. However, despite the fact that a lot of people say there's no utility in checking AMH, that it's not a fertility test, or that you shouldn't check it unless you have infertility, I find that actually really false information because I see patients every single day who find out that their ovarian reserve is low and they make different decisions with that information. Meaning, if your egg count is low now, even if you're not looking to try to get pregnant, you are now set on a pathway that you likely will go into menopause earlier and run out of eggs. And even though that doesn't mean you will have infertility, it begs the question, why is it low? And what can you do about it? Because if you don't have as many eggs, certainly we need to think about if your timeline makes sense, but also the quality of those eggs becomes even more important as we start thinking about our body. So when it comes to egg quality, a lot of people simplistically say, well, egg quality is genetics. If you're young, no problem, don't worry about it. However, a lot of the things that actually can cause low ovarian reserve actually can impact your egg quality too. And these are things that often impact you through chronic inflammation. So whether it's endometriosis or autoimmune disease, toxin exposure like cigarette smoking or BPA, these things can impact both the number and the quality of our eggs. So I think it's a little bit deceiving to say that AMH is not a fertility test. Yes, again, high level doesn't mean you'll be fertile. Low level doesn't mean you'll have problems. But we need to think about the fact that your body is one. And why would one variable be low? Can't that impact the function as well? And so I always want to go a step further and not just say, oh, your AMH is low, no big deal. Importantly, if you get your AMH test, you always have to have this interpreted, and I recommend following it up with a follicle count if it's low. And the reason why is that the lab values that you'll often see on a blood test are just generic ranges. They will say anything less than 1 is low because we're taking all the women in the population. But at different ages, you have a different level what should be normal. Because if you are 30 and you have a value of 1.2, well, that's low for your age, and that warrants an investigation. So always make sure if you're getting a test back that you do get it interpreted appropriately so you really know what that data means. But I know you're smart enough to understand this. So if your eggs are inside your vault your whole life and they're absorbing the wear and tear of your life, a couple different things do happen over time. And I want you to wrap your brain around the idea that your egg quality is both the genetic normalcy of your eggs, but also the metabolic competency of them. And what I mean by that is that your chromosomes are frozen in a stage of meiosis or cell division called metaphase. And this is where they meet in the middle. And for whatever reason, inside your ovaries, your eggs, your chromosomes are held in metaphase of meiosis until you ovulate. So if you ovulate at 25, 75% of your eggs are going to be held in that normal position. But if you're ovulating and you're 40, now only 25% are going to be held in that normal position. This is because the older you are and the longer we've asked those chromosomes to sit there, the higher likelihood somebody's going to get out of line. And you may have heard me before use the analogy of a bunch of kindergartners. The longer I ask them to be in line, the higher the likelihood somebody's going to get out of line. And that holds true no matter what, meaning you can't have a great lifestyle and totally overcome your age. But my argument to that would be if you are older or you know you're waiting to start your family, then trying to improve the quality of your eggs by other factors becomes even more important. And what do I mean by that? The metabolic function of the eggs is also vitally important. The egg has to have the mitochondria that has to function. It controls all early embryo growth and development. It's got to properly make hormones. So the egg has a functionality to it that's beyond just having normal chromosomes. So people who equate egg quality simply to age, yes, age is a huge predictor, but it's not the only one. That metabolic function of the egg is highly sensitive to chronic inflammation. And we think about inflammation, this can be insulin resistance, toxin exposure, the foods that we eat. These variables can impact the ability of the mitochondrial to function, the egg to be able to divide, and it can also go back and affect those chromosomes. And I like to say if inflammation are puppies and kitties and candy, the kindergartners are getting out of line. And this is why we see that chronic inflammation can have such a detrimental impact on your egg quality. So I want you to hear all this information and say, what does this have to do with me if I don't want to get pregnant yet? The only thing I've heard is that I should only care about this if I'm wanting to freeze my eggs. The argument there is that you cannot make a decision about what you will do in the future because you're not in that position yet. So you need the data so that you can be in that position. Every single day as a fertility doctor, I see women who are faced with impossible decisions. And they may have thought they would do one thing, but then when it's sitting right in front of them, they actually may make a different choice because you deserve the opportunity to evaluate your life and make the decisions that are right for you. So if you find out your egg count is low, number one, why? Number two, how can we try to improve quality to the best that we can? And number three, we need to think about our family planning goals and what this means for us. I have had people start trying for a family earlier. I have had people start considering egg freezing or embryo freezing. I've had people do nothing. At the end of the day, you being the one to make the choice, even if you get all the data, you do a workup, maybe you change your life, maybe you don't, but you end up saying, I'm not going to freeze my eggs, or I'm not going to start trying to have a kid. I'm not at a place where I can do either of those things. But you being the one to make that choice, instead of having that choice made for you by time, is very important because your fertility is finite. And at some point, your body will make a decision for you. And my goal is for you to be the one making those important decisions for your life. One of the places where we miss the warning signs for having a low egg count are actually cycle abnormalities and cycle tracking. This is because a lot of us don't really learn about our cycle and we don't really learn about cycle tracking. Therefore, we are on hormonal contraception. We're not really having a cycle and we lose that warning sign that something's happening. So I've had patients who've been on the birth control pill or had a hormonal IUD and they weren't having periods and they were very happy with that contraception. But then when they stopped it and they didn't get a period, they actually found out that something was abnormal and their egg count was very low, or they might be at a place past the point of no return. And I have one patient who was in her 20s, stopped the birth control pill, and her period never came back. And it turns out she was in premature ovarian failure at that time period. And she had to use donor eggs to get pregnant. The thing that she had the hardest time with wasn't that she was on the birth control pill those years, because it was a great contraceptive for her. It was the fact that she never got a warning sign. She never got the opportunity to do something different because she didn't know. She never had an AMH checked earlier. And in fact, she brought up to her doctor once that her mom went through menopause really early, and she asked if she needed to do anything different about that. And she was told no, not to worry about it until she wanted to get pregnant. And that was actually really terrible advice, because we know that if you had a first-degree relative who went into early menopause, you have up to a 6 times higher rate of going into earlier menopause yourself. There's a huge genetic component as well. So I think that it's really important that we do learn these things, because that patient, the one thing she held on to is, I wish I'd advocated more for testing earlier. Maybe I would have made a different decision. Maybe not, but I didn't get the chance to make it. And I don't want you to be in her shoes. I want you to be the one who's in charge of making this. And so your period does actually start to change and give you some warning signs if we learn how to leverage it. And if you're on a long-term contraceptive, of course, pregnancy has its own risks. You have to be ready to get pregnant. But there's an argument to be had about, should you take a break from the pill or from an IUD before you get your next one placed? Should you allow your body time to see what your cycle is showing? Absolutely yes. If you want to be pregnant soon, I recommend stopping contraception at least 3 to 6 months before you want to be pregnant. But even in your earlier life, if you're at a time period where you could, this could be a great way to just know things are functioning normally, because the best sign of hormonal balance, and remember, hormone balance is that your brain and ovaries are communicating appropriately and responding appropriately, is actually having a regular, predictable cycle and a normal ovulation. But your cycle tracking apps are not telling you anything about your ovulation. I mean, they're predicting it based on a calculated value, and that's called the calendar method. But they're not actually leveraging your body signs unless you're using other techs or wearables that are measuring some of these fertility awareness methods. So let's talk really quickly about what a normal cycle is and what you should look for, and then all the lifestyle factors I want you to start to focus on at an earlier age that I told this group of medical students, and they were both happy and mad at me, because this is information that nobody talks about, at least from the context of hormonal health. So when you think about your cycle, you have the group of eggs that are coming out of the vault, each egg inside a follicle. At the start of the month, the brain is sending out FSH, which is follicle stimulating hormone. FSH is getting that follicle to grow, and as it grows, it's making estrogen. And this is considered the follicular phase, or the first half of your cycle. Your estrogen levels are raising. This is going to make you feel good, increase energy, concentration, lower resting heart rate, improved heart rate variability, improved performance, improved libido. This is estrogen dominance, and this is probably when you're going to feel your best and have your best gains. Once estrogen is high enough for long enough, the brain actually senses that. So remember, your brain doesn't see what's happening. It has no idea what's actually happening in your ovaries. It is waiting to see that estrogen signal in order to respond. So once it sees estrogen at 200 picograms for 50 hours, very specific amount, it now knows that there's enough estrogen around to send out a surge of LH, or luteinizing hormone. And that LH allows the follicle to rupture, the egg to come out, and the follicle will reform and become the corpus luteum. And you're now post-ovulation entering into the second half of the cycle, known as the luteal phase. The luteal phase is where that corpus luteum is going to be making progesterone impulses in response to LH pulses from the brain. And the corpus luteum is typically going to live for about 2 weeks unless you get pregnant. If you're not pregnant, the corpus luteum will die, progesterone will drop, and you will get a period. Well, when you have progesterone around, you're going to start to notice that this is a progestational hormone, meaning your body is preparing for pregnancy. So it is going to cause you to shift. You're going to have a higher core body temperature. It's going to conserve energy. Your resting heart rate's going to raise. You're going to suddenly be hungrier. You're going to want to take in calories. You're going to be more fatigued. So your metabolism is shifting to prepare in case you get pregnant. And these changes are very normal. And knowing what to expect, you can allow your body to know, oh, I'm just in my luteal phase and this is normal for me. Well, your body actually has some changes that are occurring with these different hormones, and these are called fertility awareness signs. And so beyond just the calendar method, which is the idea that the corpus luteum should live for about 2 weeks, and we'll just subtract 2 weeks from your cycle length and call that your ovulation day, using these signs of fertility awareness allow you to have a better idea of what's happening. And these can be ovulation predictor kits. These are tests where you urinate and check an LH hormone. LH is going to cause ovulation to happen. Well, that test is going to allow you to know, oh, I'm going to get a positive LH the day before ovulation. Those are great if you just want to confirm other symptoms you're having. There's a lot of urinary-based hormone tests that are more expensive and more comprehensive. They're not necessarily better. And that's a great option, I think, if you want to get pregnant. I would not use them month after month if I'm not trying to get pregnant unless I cannot rely on other signs. The two other signs that I do like are basal body temperature, which is based on that idea that when your body makes progesterone, your core body temperature is going to rise by at least 0.4 degrees Fahrenheit. So if you can detect that rise in temperature, you're going to know, oh, I did in fact ovulate. So this historically has been a very hard measurement to do, where you have to take your temperature with a specific thermometer and chart it on graph paper. But with the advent of wearables, this has been a lot easier. And so this is something that can confirm ovulation did happen. And when paired with certain algorithms on certain apps, it can actually try to predict ovulation as well, especially if your cycles are quite regular. And then there's also cervical mucus monitoring, which is one of my favorite because it's free, easy, and your body's telling you the symptom. As your estrogen is raising, when it gets to the peak levels, it's going to change the cervical mucus. The cervical mucus is the protective barrier to prevent sperm from entering into the uterus, or really to prevent anything from entering into the uterus because it doesn't want to have an infection inside. But it does want sperm around the time of ovulation because your body's meant to help you get pregnant. So peak estrogen changes the consistency of the cervical mucus to allow sperm to swim through, and it becomes sticky, stretchy, and egg white. And we call this type 4 cervical mucus. So to check your cervical mucus, you don't have to do anything weird. I recommend just wiping with toilet paper before you go to the bathroom and then looking at the toilet paper. And you'll notice that cervical mucus will be clear, sticky, stretchy, like an egg white. That's that day of ovulation. And if you mark that as your day of ovulation, now you're able to say, well, how many days is my follicular phase and how many days is my luteal phase? This is important because a couple different things start to happening as we see changes in our hormone function and our ovarian reserve. The stages of ovulation disorder: perfectly regular cycles, having a luteal phase that is at least 12 days or more. As we start to shift into the first stage of ovulation dysfunction, you're going to have an abnormal luteal phase, which can be a shortened luteal phase or spotting in the luteal phase. Both of those can indicate actually an ovulation problem, because if the brain and ovary are not connecting as well, if you're not ovulating a follicle that's of its best capacity, well, that's the foundation for that corpus luteum. So you're going to have trouble having a good functioning corpus luteum. From there, you're going to start to have changes in your follicular phase, where the follicular phase might start to lengthen out, skipping cycles altogether, and then having amenorrhea or no period. Well, one of these changes you can start to see when you have a lower egg count can be luteal phase shortening, but you also can see classically a shorter follicular phase. And if we just think back to what was happening with the menstrual cycle, if you have a lower number of eggs coming out of the vault because your egg count is getting lower, and when you have more eggs in the vault, more come out, and fewer eggs in the vault, fewer come out, the brain has no idea this is happening. And the brain is going to send out its normal amount of FSH. That normal amount of FSH is now going to be a stronger signal to each follicle because there's not as many of them. And the follicle or the egg is going to start to grow and mature at a faster rate. Estrogen will rise sooner and you will ovulate sooner. So one of the classic red flags for you having a lower egg count is actually a new onset shortening of your total cycle length and specifically your follicular phase. So if you tell me, my cycles always used to be 28, 29 days, but now they're 25, 26, and I'm ovulating on cycle day 9 or 10, suddenly I think that you're ovulating a lot earlier in your cycle, and I am concerned that you have a lower egg count, and that is why this is happening. If you notice this and you're able to get an AMH checked and get this worked up, you now will have that insight that my patient didn't have, that your egg count is changing at a faster rate and that there's something that you can do about it. A really important idea here is that your fertility is actually a health marker. And what that means is that women who have infertility have higher risks of certain chronic diseases later. They have higher rate of stroke, cardiovascular disease like a heart attack, higher rate of metabolic syndrome, diabetes, cancer, and early death. And those things are terribly scary. And as somebody who had infertility, I hate that. I hate this data. But the question here is why? Because it's not that infertility is causing you to have a heart attack later. It's that so many people who have infertility have cellular dysfunction at the root of what is happening. And this is impacting their egg quality, their hormonal function, and their risk for disease later. And that's why I always say your fertility is a marker for your longevity, for your health span. Having normally functioning hormones now improves the odds that you're going to have normally functioning hormones longer and have lower health risks. And regardless if you want to get pregnant or not, This is why we have to start thinking about, why is the rate of infertility increasing? Why is the world around us becoming more inflammatory? There's more autoimmune disease. There's a crisis right now when it comes to our fertility. And this is scary beyond just getting pregnant, because this means a generation of women are going to have a higher risk of other disease states as well. And I don't want that to be you. So this is why I want you to start thinking about, if inflammation impacts a lot of these processes, how many eggs I have, the quality of the eggs, how I ovulate. Because do you know what inflammation does? If the brain can't see what's happening at the ovary, and we use the analogy that this is air traffic control, inflammation is static interference on the radio. Suddenly the brain can't hear the signals from the ovary as well. The ovary doesn't hear signals as well, doesn't respond as appropriately. So we're starting to learn that the world around us is inflammatory. Day-to-day life is pro-inflammatory, causes insulin resistance. The things you eat, the choices you make, those things actually impact your fertility and your hormonal health in so many different ways. And I want you to start making those changes well before you want to get pregnant. Or if you're faced with infertility, trying to change the quality of your eggs is the single most important thing you can do. Because even if we're doing IVF, I have to work with the egg and sperm quality you're giving me. So looking at your life, taking charge of your fertility isn't just saying, oh, I hope I have good luck. It's actually pivoting and saying, this is much more than luck. This is understanding my body, knowing what to look for, advocating for my health, going to the right doctor at the right time, and controlling all of these factors that do in fact influence my fertility. And I want that to be you. Knowing more about your body doesn't create pressure, it creates options. It puts you in the driver's seat and allows you to be in control. And ultimately, I want you to be the one not relying on luck, but making the right decision for your future. The best time to learn about your fertility and your body is well before you want to get pregnant. If that is who is hearing this, you're in the right place. If you're later, share this with somebody who's earlier on and know that it's not too late to make a difference. I have patients every single day who make changes and have a different outcome than they've had somewhere else. I have women reach out on the internet who had children at older ages because they followed this advice. So it's not too late, and you are the one who can make a difference. So what should you do? Number one, you should know you're normal. You should know how your cycles are, know how to track them, how long are your luteal and follicular phases. Your period should be regular, predictable. Your luteal phase should be at least 12 days in length. You shouldn't have terrible pelvic pain. You shouldn't bleed through your clothes. You shouldn't have a lot of spotting. You should consider asking for an AMH test so we can know what your baseline ovarian reserve is. Don't wait for your doctor to bring this up. You should bring this up. You should ask for an AMH test. If they tell you it's not a marker of your fertility, you can say, I understand that, but it's still data that would be very helpful for me in making decisions about my future. And if all else fails, see a different doctor, see a fertility doctor, or there are mail-in options available for testing ovarian reserve like AMH. You need to learn how to support your fertility and hormonal health with lifestyle. So here are some really easy starting point tips. Number one, sleep more. Sleep is when your body's going to heal all of that inflammation. It is when it's going to set the foundation for your day. You need to get at least 7.5 to 8 hours of sleep at night. I want you to sleep in a dark room, cool space. The quality of your sleep is very important. And especially for patients going through infertility, trying to get pregnant, or at a younger age, sleep is often the first thing we give up as we're focused on other variables. Set the right environment. Get a sound machine, get a sleeping mask, set the stage that sleep is essential for you. You want that inflammation to heal up. You want your blood sugar level to lower. You want to start your day not in a deficit. And if you have a partner who sleeps in the bed with you, you've got to have this talk because you have to be on the same sleep schedule. Number two is going to be managing stress. Stress can really impact your body and your fertility. Chronic stress means you're having that pro-inflammatory hormone cortisol constantly activated, and your body is not meant to deal with that. Chronic stress can cause inflammation and insulin resistance. Insulin's a hormone that helps glucose from your bloodstream get into your cells, and it's what your cells use for fuel. And so normally you eat food and insulin levels are going to rise, helping glucose get into the cell. Insulin resistance is when your cell gets so used to seeing insulin that it stops responding. And this happens when you have constantly elevated blood glucose levels. And this isn't just impacting diabetics or pre-diabetics, but insulin resistance can cause infertility itself, impacts egg quality, and causes chronic inflammation. Stress causes insulin resistance because it is freeing up glucose from storage, getting your body ready to use up this energy and run away from the bear, but you never run away from a bear because that's not what causes stress in modern life. In order to deal with chronic stress, you need to think about a way that you can truly combat this. And this is both preventative in how you structure your life. This is carving out time to stress manage every day, but also having a game plan for when something stressful does happen, you know what to do. Number 3 is going to build and use skeletal muscle. So not thinking about exercise as a cardio burn only or Pilates or yoga, but truly resistance and strength training to build up skeletal muscle. Your skeletal muscle has a transporter called GLUT4 that can allow glucose to get into the cells without needing insulin. This can allow you to lower your insulin resistance levels, lower inflammation, and this should be something you start doing at a much younger age for hormonal health. 3 times a week, strength training, build your muscles, use your muscles. Number 4 is going to be the foods that you eat. One of the top things that we do that increases our inflammation is to eat foods that are not just neutral, but they're actually harmful. Ultra-processed foods are highly inflammatory. They cause insulin resistance. They have toxins in them. We want you to be at a place where you're feeding your gut microbiome with high levels of fiber, and this is coming from fruits and vegetables and whole grains, those real foods. I want you to shift how you're eating and know that when you're exposing your body to these junk foods and these ultra-processed foods, your body is going to adjust and accommodate, and you'll be exposed to chronic inflammation that will impact your hormones and your fertility. So it's not that it's something that's too late. Your eggs have a life cycle as well. And I always say the total span of an egg getting chosen from the vault to ovulating might be around 300 days, but probably the 90 days beforehand and specifically the 30 days of the ovulatory cycle are when the egg is most sensitive. So you can make changes right now that are dramatically going to impact your life. And so thinking about eating more fruits and vegetables, eating more fiber, hydrating more, these are things that you can start to shift how you're doing and see a difference. And number 5 is going to be toxins. And it's not just endocrine disrupting chemicals, things in plastics and Teflon that we're exposed to in our homes and in our kitchen, but also think about the toxins that we choose. Things like drinking alcohol, cigarettes, marijuana. Those toxins actually can be very damaging to your fertility. And I want you to be in a position to be your healthiest self. If you're not in a position where you want to give those things up completely, at least think about limiting what you are doing when and giving your body time to rest and to heal. Ultimately, thinking about if you do want kids in the future, coming up with a game plan. I recommend that if you're in your early 30s and you want kids someday but not now, and you haven't done any of this, learn to track your cycles, get an AMH tested, talk to a fertility doctor, and consider egg freezing. It may not be right for you, but you deserve to learn what the process is and make that decision for yourself. There's no one right decision. Free yourself from the idea of doing the right thing and allow yourself to be in the place of making educated and informed decisions for you, not just relying on luck, but making active choices to set yourself up for success and at least knowing you did everything possible to have the best hormones you can and to optimize your own fertility. Your mindset matters because this is tough. You're not behind. I know you might have friends at different life stages. And when it comes to our fertility and our reproductive future, we are all on our own pathway. But know that you are as educated as you can be while you're on yours, and that you can start to make changes now so that even if you're not trying yet, or you're not in a position where that's what you can do, you are taking charge by preparing your eggs to have the best quality possible, allowing your brain and ovaries to communicate freely without interference, and knowing that you are the one making these important decisions for your life, both now and in the future. Again, there's tons more information in my book, The Fertility Formula, which I would love it if you would consider pre-ordering at nataliecrawfordmd.com/book. You'll get access to my hormone reset guide, the IVF course, and you can come to our Fertility Formula book club and learn even more about your body. Until next week, thank you, friends.
Thank you for listening to the As a Woman podcast. If you're ready to take control of your reproductive health, my new book, The Fertility Formula, is your next step. It's a science-backed guide to understanding your hormones, optimizing your fertility, and owning your reproductive future. You can order your copy and learn more at nataliecrawfordmd.com/book. And as always, follow along at Natalie Crawford MD for even more support, because knowledge is power, and your health deserves a formula made just for you as a woman.